this is a really good book. Martin Luther was a German priest during the 1500s. He became disgusted by the selling of indulgences by the Catholic Church, so in 1517 he posted his 95 Theses on the door of a church in Wittenberg. The 95 Theses was mainly about the selling of indulgences, but there are a couple of other things he mentioned in there. Many people agreed with Martin Luther and decided to follow him. Because of his 95 Theses, he went to trial to apologize for what he had done, but he refused to apologize because he feared God more than the Catholic Church. So he decided to listen to God instead of the church. He was excommunicated by the church and later on was banished from his region. Many people still followed him after his death. Martin Luther's influences have included Lutheranism, the banning of indulgences from the Catholic Church, and the start of what became known as the Protestant Reformation. What we're about to see takes place in a modern-day hospital. The hospital represents the Catholic Church. The chief of surgery represents the Pope, the attendings represent the bishops, the residents and interns represent the priests, and the patients represent the people of the church. Now, let us begin our story.
Chief, who is this guy? His charts say he stubbed his toe. We've got guys in the ER who are bleeding out all over the floor.
Mr. Johnson is a very wealthy benefactor of the hospital, and if we treat him very well, then he'll be able to give us a lot of extra money that we need for this hospital to function.
This hospital doesn't run on patients who pay the most. It runs on helping patients like John Doe, who got in a motorcycle accident and his guts are falling out.
He doesn't even have health insurance. He can't afford his hospital bills.
Jimmy Johnson stubbed his toe. He can't wear a shoe. The end of the world is not coming because Jimmy Johnson can't wear a shoe.
Excuse me, when am I being treated?
We'll have
Look
someone...
at my toe.
I'm very sorry
It isn't
about the
pain.
wait.
I am Jimmy Johnson, a professional NASCAR driver. I got a big race tomorrow.
We'll have someone in very shortly.
It needs to be done now.
Alright, I'll have Dr. Luther in right away.
Okay.
Very sorry about the wait.
Thank
You have to go treat your patients that you're assigned, and then once you're done with that, you can go help that guy who's in a motorcycle accident.
Alright, Mr. Johnson, how'd you stub your toe?
Well, you see, I was at my house, and I decided to go upstairs. So on my way up, I stubbed my toe.
Has it been hurting a lot?
Of course it's been hurting.
It looks like a minor stub. This really is not going to be much of a problem. I'll wrap it up for you. You'll be fine within a couple days. Next time, this really isn't a need to visit the hospital. You'll be fine with a stubbed toe. You can pull it out. You can just put some ice on it. We had Ricky Bobby in here last week, and he had a concussion and some spinal injuries. You stub your toe, you're going to be fine, Mr. Johnson. I'll have the nurses sign you out. You'll be going home in a couple minutes.
Okay.
And this is the operating room. Oh, Dr. Luther, this is Dr. Patel. She's going to be assisting you on your surgery today.
That's Chief.
You know the patient?
No, Chief said you'd fill me in.
How long have you been in this hospital? I haven't seen you around.
Well, I've been in it for about a week, and then the Chief mentioned some promotion after the week to residency.
Early promotion after just a week?
Yeah.
Patient's been in a severe motorcycle accident. There's been a lot of internal bleeding. We're not sure exactly what the problem is.
I see.
So I'm going to start by perforating the affected area. Scalpel, please.
What's a scalpel?
It's a bladed device.
This?
No. No. The other one.
This one.
No. Thank you.
You're welcome.
Cutting into the patient. Chief offered you a promotion?
Yeah.
How did that come up?
Well, the Chief came over our house one day, and she said she needed money, and so the Chief, my dad, he donated a whole cardiac wing. So I just happened to pass by, and Chief just said, hey, do you want to get to your residency faster? Because it takes about 3 years. And I said, okay, because I'm in med school already.
Alright. We're going to start with the probe now.
Mm-hmm.
Should start the monitor.
Mm-hmm.
Alright, there appears to be a lot of internal bleeding right around this area, so I'm going to position it there. Could you start performing the surgery?
Sure.
Okay. Go ahead.
Are you sure about this?
Yep.
Oh no!
What did you... Alright. There's been a lot of bleeding. What did you do? Get out of here.
Hey, so I heard that you guys botched the surgery the other day. Like, what happened? You're usually such a great surgeon.
My intern botched the entire surgery when I let her take over. Because the chief brought her in with absolutely no knowledge of what was going on just because her dad bought the new cardio wing.
Oh, I'm sorry to hear that. I guess the hospital really needs money right now,
The chief shouldn't be paying attention to how much money we need. She should be paying attention to the patients that need care.
though. Yeah.
Morning, doctors. It's good to see everyone's utilizing this old gym. We should sure use a new one. Maybe some wealthy patients or doctors are willing to supply money for a new gym.
Yeah, I'll ask around and see if there's any doctors or patients that would be willing to donate some money.
Yeah, that would be great. We could sure use it.
So, I know that you don't like that, but that's just the way the hospital is.
It's not fair. I have to take a stand.
Hey, don't forget there's a board meeting at 5 tomorrow. Be there. So, you know, Dr. Luther seems kind of upset lately. Do you know what that's all about?
Yeah, he's been really upset since he lost that patient the other day. And because of that, he was really upset about the intern that didn't know very much, and also about how the wealthy patients were getting taken first. But I don't understand why he was so upset. I mean, that's just the way the hospital always has been.
Yeah.
He's really late though today. I hope nothing's happened to him.
Sorry I'm late. I had to type up a document to present to all of you. I brought you donuts. I copied a version of the document for each of you to look at so you know what I'm talking about. I titled this document 95 Reasons to Change the Hospital. First off, the hospital's been hiring doctors that have no idea what they're doing, and this is a practice that we really need to stop. We need to be hiring doctors based on the amount of practice that they've done, not on the amount of money that they can offer the hospital. Second off, we need to be treating our patients equally, as equal people, not as a hierarchy of who has the most monetary value. We've had a huge problem with this because none of the doctors have been listening, and so I was forced to bring this all to the board.
Why didn't you bring this up to me earlier? This
Because
is not
you're a failure,
this is
Chief. I have brought with me my great friend, Lucy. Lucy has been living on the streets of our city in a cardboard box for several months now. And during that time on the streets, she has infected herself with tapeworms, which are eating her slowly from the inside out. Now she comes to our hospital, and all she wants is care. There's another man in the waiting room who needs no care and is going to be treated before her because she has no money because she's been living in a cardboard box. Now Lucy finally does get into the OR, and she has 2 doctors working on her. Neither one of them have any idea what they're doing because they've never practiced medicine before. These doctors are going to kill Lucy. Lucy's going to bleed out on the table, and she's never going to go back to her cardboard box home. Her cardboard box pets are going to be very upset.
What are you talking about?
I'm talking about the fact that
No, this is ridiculous. Just sit down.
I will not sit down. I will not be silenced because there is extreme corruption within this.
This is ridiculous. How do you expect us to get money for
I
the
don't expect
hospital?
us to get money. That should not be our primary concern. Our primary concern should be with dealing with patients who actually need the help.
But we're still helping the patients. We're just
We're
switching
not
the order.
helping any patients. We're helping people like Jimmy Johnson, who doesn't need to be here because he stubbed his toe. He could easily fix that at home. Lucy
It hurt
has
a
worms
lot.
inside eating her from the inside out. She's been living in a cardboard box, and we're going to turn her down just because of that.
Well, we're probably not going to be able to help her anyways.
Why?
Because when
Is it
worms
because
are
people
eating
like
you,
this are incompetent and have no idea what they're doing in their position?
No, this is ridiculous. You have no right to
I have
come up
every
here.
right. You're ridiculous.
We can't stand for this. You can't just come in here and disrupt our board meeting.
I have to end the malpractice that this hospital has been doing. It's wrong, and we need to do something about it. And if you can't do something about it, then I'm going to be forced to take more drastic measures than this.
No, this is just how the hospital runs.
This
This
is
is how
not
it's
how the
always
hospital
been, and
runs.
this is how it's always going
When
to
the
be.
hospital was first created, the institution was pure, and it was simply about helping people.
Yeah, and it wasn't working, so we changed it to this.
No.
No, we can't stand for this. If you keep acting out like this, I'm gonna have no choice but to fire you.
I didn't want to have to leave this hospital, but if you're going to keep doing everything wrong, then I have absolutely no choice but to do something more.
It's too late. You're fired. Get out.
No,
of here.
you know what? I quit. I'm not fired. I'm taking these donuts. I'm taking Lucy. I'm not coming back.
So that's how it works. Do you get it?
Yeah, pretty much. I just have one question. If it comes down to a rich patient with a minor injury or a poor person who got hit by a train, who do we serve first?
The person who got hit by the train. Before Dr. Luther died, he gave me complete instructions of what to do. If you look, it says right here, help the person who's in need before helping the wealthy. So
Alright.
because that person got hit, even though they're not wealthy, you need to help them first. Does that make sense?
Yes, it makes perfect sense.
Hey guys, what's up?
What's up, Chief? Hey, Alec, can you go take care of that patient down there? He looks like he's in some serious conditions.
All right, I'll go do
I
that.
don't think his leg's supposed to do that. So, how's your hospital been doing, Chief? I haven't heard about it in a while.
It's been pretty good, but we're under some changes lately. We've kind of decided that things aren't going so well with the hospital as it's been in the past, so we're gonna change some things around.
Really? What kind of changes?